Thank you for joining me for this lesson on reference-based pricing. We call a better way to afford medical care. Anybody who tells you that they have the answer, run away from them, because healthcare, the reason it costs so much is a very tough and complicated answer. There's no best answer. There's no best or perfect solution. But there are better ways to control and reduce medical care prices. We're going to discuss one of them here called reference-based priced health insurance. Very popular on the East Coast and becoming more so here in the Midwest. But first, let's consider the hidden tax that's lurking in every healthcare bill. We call it the hidden 87% tax. See, each time you receive medical care, your doctor and hospital sends your insurance company a bill. And the amount that's paid between you and your insurance company is, on average, get this, 187% above what Medicare pays for the same service to the same doctor or hospital at the same time. The medical community relies on this extra 87% to cover their costs because Medicare at 100% of its reimbursed level does not cover the cost for most medical care. So in this way, if you have private insurance, you're paying an extra 87%, and we call it a tax, to support government-provided health plans, Medicare, Medicaid, and other government plans that reimburse providers at very low rates. Without your 87% extra, these plans would not be working. The whole system would collapse. So there is a new way, we call it a new old way to pay for healthcare, and that's reference-based pricing, which is a transparent insurance policy with maximum patient freedom at a reduced premium cost. In a sense, it establishes a price that the health plan will pay. It isn't relying on negotiations between a health plan and a provider. Now think about it, healthcare, it's absolutely different from any other purchase we make. With healthcare, we don't know the price before we receive the care. We can pay anywhere from 1 to 10 times or even more for the same thing and never know that we could pay far less. We're liable for the entire bill no matter the charge, even if it's outrageous. Someone else uses our money to pay our medical bills, and someone else tells us where we have to go to see a medical professional, and we don't know the quality of what we're purchasing even afterwards. So how do we purchase everything else other than healthcare? We think about buying a car or anything. We ask, what do I need and when do I need it? And we know the price before we spend the money. We could shop based on price. We could plainly see the price. And we're not likely to spend the money if it's too much. It's our money, so we make the decision. We can go wherever we want to choose to make the purchase. And we can get information to know the quality. Mainly, we get to make the decision and we can choose between alternatives. Why don't we know the price of medical care services before we buy them? Well, they don't want us to know. The industry has created such a complicated pricing system and made us dependent, if you will, on the insurance carriers to negotiate prices for us. If they let us know, we could probably do this ourselves. So let's compare two types of medical care users. We have those who like today's managed health insurance policies. They're comfortable with them. We have another kind who would like to spend less on a self-managed insurance policy. And this type of person wants to be more independent with their own healthcare decisions. Maybe that's you. This one wants someone else to take care of their healthcare decisions. They're comfortable with other people managing their healthcare. This one wants to spend more of their own money on something other than health insurance. And this one prefers to spend more of their money on a managed care health insurance plan. Over here, they want multiple options, and here they're willing to live with limited options. Doctors and hospitals have to satisfy the patient on these self-managed plans, while over here, doctors and hospitals have to satisfy the managers. Quality is determined by the patient under a self-managed policy, where quality is determined by someone else on a managed care policy. It's all okay. It's their choice. They should have that choice. But the effects of third-party managed care over the last 30 years It has made unaffordable health insurance premiums. We just can't afford them anymore. And the Affordable Care Act has made it worse. Belief that healthcare should be free or inexpensive, comprehensive, and unlimited, and somebody else should pay. The dumbing down, if you will, of consumerism in healthcare purchases, and a sense of helplessness against the system, a belief that someone else can make decisions for us. So we see restrictions on our choice of care. We see increased government control of individual healthcare due to the failure to control cost. Now, we could choose either of these. We could choose an old managed care insurance policy, or we could choose the new self-managed insurance policy based on a reference-based price system. We see all the prices here. Over here, prices are secret. We could choose our providers. Here, others choose our providers. We're able to know the price and get it directly from the provider. We trust others to negotiate with providers for the best price. We control our premium based on how much we're willing to have insurance pay for us. Others set our premium based on the networks from which they allow us to choose. We work directly with our doctor to choose the type of care we prefer, or health plan managers instruct our doctor on the care we're allowed to receive. Administrative costs of insurance are reduced with these policies. Administrative expenses are higher than a self-managed insurance policy. There's been 3 recent attempts in Minnesota to reduce prices. One of them is what we call patient-directed health plans or consumer-directed health plans, usually paired with HSAs, HRAs, FSAs, those sorts of things. Secondly, pricing transparency, which has become a really big movement here in the last few years, where we're allowed to see the prices under certain circumstances. And then there's the new way to pay, reference-based pricing. Reference-based pricing for care is the next step that allows us to take advantage of price transparency. For the question is, if prices are transparent, if you know something costs $200, how do you know it's a fair price? It has to relate to something. So to determine a fair price requires a common reference-based price to compare with each provider's price. There just happens to be a common reference-based price already used today for almost all healthcare pricing, but hardly anyone knows about it. It's the Medicare allowance. It's the most widely reference-based price used all across the country, and it has been for decades, and it's nothing new. Insurance companies, in fact, use the reference-based price, the Medicare price, to build upon to determine how much they're going to pay for providers. It's the way it's done now. Their discounts are really nothing more than a markup from the Medicare price and a discount from the price that the provider charges or pretends they charge. So reference-based pricing makes price transparency valuable. For most healthcare services, our insurance company already pays a percentage amount based on what Medicare pays for that service. Now, in Minnesota, state officials found the average priced insurance, private insurance that companies paid for medical care is 187% above Medicare. So that means, for instance, if Medicare paid $100,000 or allows $100,000 for a surgery, our insurance, our private insurance for the same surgery, same doctor and everything, would pay an average of $187,000. And Medicare pays $100 for something like an exam. Our insurance is going to pay about $187,000. That's based on 1.5 million patients, $8.6 billion in payments for various kinds of procedures by Minnesota Measurements, a Minnesota agency. So if we know the percent, that's the thing, if we know the percent the medical professional or facility charges in reference to the Medicare rate, we can compare the amounts they all charge. We can say, for instance, what percent do you charge over Medicare when we talk to a medical provider? So if we want to get a medical service, we can ask each clinic, what percentage do you charge above Medicare? Or we could have a law that requires them to publish their rates above Medicare. Then we could ask one or the other, how much do you charge? So let's say we want to get an office exam and we have a reference-based plan. So Clinic A, we find, charges 125% above Medicare. Clinic B charges 175% above Medicare, and Clinic C charges 100% of Medicare. Well, knowing this, then we could choose the doctor with the lower rate or the higher rate or the in-between rate. It's up to us based on how much our plan pays and the value to us of the doctor's work, shown by our willingness to pay his price. Let's talk about delivery of a baby. So Pat and Jan are going to have a baby. They ask each hospital, what percentage do you charge above Medicare? Hospital A charges 175% over Medicare. Hospital B, 300%. That's the fancy hospital. And the basic hospital, 140%. By the way, the TPAs across country tell us that most providers will accept 140% as payment in full. So they ask the hospitals, Pat and Jan, what are you going to charge and what you're paying for and whether there are options. And they're going to choose the hospital based on the value that it presents to them and their willingness to pay their price. They may want to go to the 300% over Medicare hospital because it's closer, it's got a famous doctor, or Pat or Jan, whichever is the woman here, has a medical condition that requires special treatment. Or maybe they want to go to the hospital nearest to them that's 175%, or they're willing to drive another 2 miles to see the other hospital at 140%. It's up to them. Let's say Greg needs a hernia repaired, so he calls the same hospitals and gets these same rates, but then he calls a local surgery center, a same-day surgery center that has very low overheads, finds out he can get it done for 110% of Medicare. They can do this because they're using Medicare as the reference base. They're going to pay, if the delivery's $5,000, they're going to pay $5,500 at the same day surgery center. I don't know. Well, they don't do deliveries. They're doing the hernia repair. Okay, so there are new kinds of health insurance policies that base the provider payments on the amount paid relative to the rate above Medicare. That's a reference-based price health insurance plan. The patient's share of the payment is determined and disclosed through their insurance plan design. For example, a reference-based insurance plan maybe will pay 150% of Medicare. So if the doctor charges $375, Medicare, let's say, allows $150, and the plan will pay 150% of $150. In other words, $225. This means that the patient can agree to the provider's price, pay the extra $150, or go somewhere else, or maybe negotiate a different price. Here's another example. Your doctor prescribes an MRI of the liver and suggests ABC Radiology. ABC Radiology discloses their retail price at $1,895. But let's say Medicare allows $385. That's the reference-based price. You say, you know, that's kind of a big exaggeration. Oh, no, actually it's not. We find sometimes as much as 20 times above Medicare allowance as the asking price. The reference-based health price at 175% over Medicare would pay $675. So you notice then there's some options. So ABC Radiology can ask for the extra $1,225 and lose patients. ABC Radiology could accept $675 as payment in full. And if that word got out, you know, a lot of people would go there. Both parties could agree, let's say, at $995, and the patient could pay the extra $320. Or the patient could go to DEF Radiology, which he finds out charges $850 for the same MRI. The value is that you're asking the question and you're getting the same service for less money. So why would someone want to pay more? Well, let's take Dr. New and Dr. Old. They're both OBGYN MDs, and they perform ovarian cyst removals. Dr. New's data shows that 98 out of 100 ovaries can be saved using his New Way procedure. That leaves 2 women out of 100 with only 1 ovary. Dr. Old, however, he gets 60 out of 100 ovaries saved using the traditional way or the old way, leaving 40 women out of 100 with only one ovary. What do you want to do if you're a young woman or younger woman who still wants to have children? So Dr. New charges $1,000 more than Dr. Old to perform the surgery. The patient is given a choice, knowing the price up front, understanding how much the plan is going to pay, and why Dr. New charges more than Dr. Old. So a woman who doesn't want any more children could choose Dr. Old and risk losing ovaries and save money. A woman who wants more children might choose Dr. New, spend more money, but know the chances are good she can keep her ovaries. This puts the patient in charge. The key feature in a reference-based plan is that it can be structured in many, many different ways. The key feature is that Medicare's allowable price serves as a common reference price. This does not mean that a provider will or should accept Medicare as full payment. In fact, very few do for a non-Medicare patient. The insurance payment can be set at different rates. The more the rate over Medicare, the more expensive the premium will be. So it's possible a plan might include a deductible and other traditional insurance provisions. In fact, it's possible, no, it's probable. For instance, a plan may pay 140% above Medicare. It would have lower premiums. Maybe it pays 175% above Medicare and would have medium premiums, and 200% above Medicare will have higher premiums. So you go to the doctor, or you go to a doctor who accepts, tells you that he accepts 150% and you have a plan that pays 200%. Doctor's not going to charge you more. You have a 140% plan and you go to a doctor who charges 200%, you're going to have to negotiate that 60% or go to a different doctor. It's kind of cool though, because you get to have that discussion. Reference-based plans allow patients to use any willing provider. There are no networks. Out-of-network care is eliminated. There's no surprise billings for out-of-network care because there's no out-of-network. It'll reduce the price of care because it's less costly to administer. There's fewer billing errors. There's open competition with other providers, which means you can have access, quality, and price, all three. They become factors. It encourages independent medical practices because it frees up the doctors from too much insurance oversight, too much third-party interference with their plan or with their services. And it allows for a physician-patient relationship without third-party payers interfering, as I just said. The patient becomes a manager of his or her own care instead of an insurance company. And it makes you more aware of the cost of care. So you understand how the cost of care relates to the premium. It allows for price and quality shopping together for the patient's own preferred providers. It puts providers on notice to have to compete for business based on quality, price, and access. And it'll improve the quality of care, we believe, as people become more aware of the options that are out there. So patients would love this because it would have more affordable medical insurance with rates reduced by as much as 50%. And by the way, cross state lines. It could receive medical care from whomever they choose. No network limitations, even across state lines. Knowing the price of healthcare before receiving it. And instead of basing a decision on who's in our network, we base our decision on price and quality of care. So you get better access with shorter wait times and a true doctor-patient relationship. Many doctors who like their independence would like this because they can practice, again, ethics-based medicine instead of being told by third parties that they have to check off certain boxes. They can spend more time with patients, less time feeding the computer, freed from top-down micromanaged third parties, and free to have independent practice and control of their own work schedules again, and competing with other doctors to provide healthcare, differentiating themselves from other doctors, greatly reducing their administrative costs because there's no more networks. There's no more multiple reimbursement schedules. Why would insurance companies like it? Some wouldn't, but it will reduce administrative costs immensely. And it increases their ability to compete, to enter the marketplace, to enter new markets without having to sign up network providers and expand across state lines. So reference-based pricing. It's a new idea, but it's really an old idea because it's based on a scheduled payment, just based on a Medicare Plus. Ask your health insurance agent about this for more information. How can your employer or you benefit from this great new way to buy and use health insurance to give you access, quality, and a better price? Thanks for considering this. Give us a call or email if you want more information.